Welcome to GW Integrative Medicine, the podcast about disease prevention and health promotion from the Office of Integrative Medicine and Health at the George Washington University School of Medicine and Health Sciences.
I'm Dr. Victoria Karakcheva, Behavioral Services Director for the GW Resiliency and Wellbeing Center and an adjunct assistant professor of clinical research and leadership here at GW.
I'm Dr. Lee Frame, the office's Executive Director, Integrative Medicine Programs Director, and an Associate Professor in the Department of Clinical Research and Leadership here at GW. Today we talk about polyvagal theory, nutrition, sleep, and embodiment for trauma with scientist Dr. Catherine Justice.
An expert in physical therapy, integrative medicine, and wellness, she uses holistic and creative approaches to physical therapy and wellness, including therapeutic yoga, posture training, and somatic education, and craniosacral therapy.
Dr. Justice serves as the program manager for Integrative Health at Hennepin Healthcare, a safety net hospital serving the Minneapolis Metro area. She's also the associate editor for the International Journal for Yoga Therapy. Welcome to GW Integrative Medicine, Kat.
Thank you so much. It's such a pleasure to be here.
Oh, and it's such a pleasure to have you.
All right. So, Kat, we're going to go with our first question. And our audience would be very curious to know, what is polyvagal theory and why do we need to understand it for trauma-informed care?
Well, thank you for asking. That's a really kind of foundational question. So it's a really good one to start things off with. So polyvagal theory was coined by Dr. Stephen Porges, and his other term for polyvagal theory is the science of safety. And I actually like that term better because a lot of people don't quite understand what you mean when you say polyvagal. But the science of safety, that's something that I think we can all kind of identify with, is what is the physiology or the science behind the feeling of safety or danger in our bodies, which is really what polyvagal theory is. And it's in some ways just this more nuanced understanding of our nervous system and how we respond to stress and threat and how we respond to safety and comfort. And when I talk about polyvagal theory generally in the community, I often will start by asking, who here has heard of fight-flight? And no matter where I go, no matter what the audience is, most people have heard of fight-flight. Most of us know like this fight-flight reaction in our bodies is very familiar to us. And then I'll say, who here has heard of rest and digest, which is, of course, the other major aspect of our nervous system. We have this fight-flight stress response, but we also have our rest and digest relaxation response. And again, no matter what community I'm in, medical communities, out in the neighborhoods, like wherever I go, not as many people are familiar with rest and digest, which I think really says something about our culture in general and what it values, that stress is more familiar to us than relaxation. But to get even more kind of nerdy in this zone, when we think of sort of the physiology and the neuroscience terms, fight-flight, which is also our sympathetic nervous system, rest and digest, which is our parasympathetic nervous system. And the two things kind of work in balance to each other. That sympathetic fight-flight sort of makes us more excited. It raises our blood pressure. It puts tension in our muscles. It has our brain focus on things in our environment that could be threats and dangers to us. It sort of primes us for this really physiological, literal fight-flight. Like if we literally have to fight or flee something, this part of our nervous system is really good at activating us. Sadly, or not sadly, actually, happily, most of our stresses in our environment today are not physical. They're not a literal fight or flight, which is good for us as a society, but not so good for our physiology because our body is preparing for this physical threat when most of us, the threats and the stress of our lives are more things that are emotional, that are relational or occupational or environmental or even systemic threats of things like marginalization, discrimination, racism, things like that. And then we have this other side of our nervous system, which is our rest and digest or our parasympathetic. And that balances out the sympathetic fight-flight response. So this is where our body is relaxed, our muscles are relaxed, we are more able to what they call co-regulate, more able to engage with other people in a happy way, that we can engage with others and be more social and feel more relaxed. And this in our primitive physiology, this was supposed to be our baseline where we spend most of our days and most of our life. But of course, in the modern world, most people aren't in this relaxed kind of Zen state all of the time. They are more often in fight or flight, which is what is this huge driver of chronic disease and dysfunction in the body, which we know that stress is bad for us. Relaxation is good for us. But polyvagal, which I promise I'll come back to. So the sympathetic nervous system is an amplified nervous system, which means that there are over 1,000 nerves that do our fight-flight reaction. The parasympathetic, our rest and digest, 80% of that neural activity that modulates this response is done by one nerve. It's actually two nerves, but they have the same name because it's kind of two branches of the same nerve. The vagus nerve is what it's called. Vagus is Latin for wandering. It's where the word vagabond comes from. So it wanders all throughout our body, but it's just this one nerve with lots of branches that does this huge job of keeping us in this relaxed state. And it turns out that the vagus nerve with polyvagal theory, so poly meaning many and vagal referring to the vagus nerve, means that the vagus nerve has two jobs according to this theory. So one of the jobs is to put us into this relaxed rest and digest state. And its other job, it's actually part of our stress response. And it puts us into what they call a freeze state. So freeze, you see it in the animal kingdom when animals literally freeze or drop to the ground and play dead. And it's a survival instinct. In the animal kingdom, it helps animals survive from extreme life or death threat. In the human body, sometimes actually that same thing happens. Sometimes we do literally freeze or we do literally play dead in the face of extreme life-threatening stress. However, our bodies will also go into a subtler form of freeze. And this happens when our fight-flight system isn't working for us. When stress becomes too much and it overwhelms the fight-flight, we will get pushed into this freeze response. And freeze in the human body can sometimes feel like dissociation, like this out-of-body experience. It can feel like a state of numbness. It's that sort of place where someone might ask you, how are you feeling? And your honest answer is, I don't know. I don't know how I'm feeling. Like you get really disconnected to your body, to the internal state of your body, and to what you're actually experiencing. And again, it's a safety mechanism. When stress is too much, this is what we do, is we kind of go numb and we kind of shut down. And so in the terms of like how this applies to our physiology and our health and well-being, fight, flight, and freeze get a bad rap. Like people talk about them as bad things, but they're not bad inherently. They're only bad if we get stuck there. So they're actually good mechanisms for helping us manage stress, but they're bad if we spend most of our life there. Because again, we want to spend most of our life in a state where we feel relaxed and social and safe. I mean, I know I do. I'm guessing you guys do as well, that's where you'd like to spend the most of your life too.
Absolutely.
Right? So polyvagal theory, the whole idea around it is finding mechanisms to kind of get us back down into that rest and digest, into that state of what they call co-regulation and social engagement when we're working together as a society and as people in a group to help us all stay in that feeling of safety with each other and within our bodies. And sometimes I'll conceive of it like a hill. So if you think of like a arc of a hill that goes up and then comes back down, it's like the bottom part of that hill is our rest and digest, which is that polyvagal, what they call the ventral vagal, or mostly the front aspect of the vagal nerve as it comes off of the brainstem. And then midway up the hill, we have our fight flight. So it's like a little bit of stress pushes us into that mid zone of fight flight. And then a whole lot of stress takes us to the top of the hill, which is the freeze place. So if we're in that freeze at the top of the hill, we can't just immediately drop back down into our rest and digest state. We have to actually go through fight flight to get there. And so we'll talk a little later, I'm suspecting, about some embodied practices, about practices that we do with our body to help us get down the hill, to get through fight, flight, and back down into rest and digest. but I could just like go on and on. I get so nerdy and excited about polyvagal theory. So you guys just stop me if I'm like rambling on too much.
You did an amazing job. Thank you so much, Kat. And I think it's interesting you said that in our society, we are conditioned to recognize stress or focus on stress as opposed to that safe and connected state, right? So I'll pass it to Dr. Frame to ask the next question.
Thank you. I have to say that really resonated with me as well. As you were saying it, I was thinking it. I was like, well, that's what our culture is all about. We're about the rat race and hustle culture. But hopefully that is changing. And I know that you are doing some work to actually apply polyvagal theory to help people have a better state of well-being. And I know, obviously, I'm interested in nutrition as well as sleep. So let's hear a little bit about what you've done for those.
Yeah, well, this is where I think having a trauma-informed lens is really, really important when it comes to looking at sleep and nutrition with folks, and having a health equity lens becomes really important too. And these things are all interconnected. In some ways, they're all the same lens, a polyvagal, trauma-informed, and health equity lens. But this is where an area too, where I think that integrative medicine and lifestyle medicine in particular could use a little bit more awareness around these topics, because so often we think of things as sleep and nutrition. We call them kind of lifestyle choices, which on some level they are, but on another level, these like quote unquote choices, they don't happen in isolation. They happen in a social context. And so understanding the social context around things like sleep and nutrition, to me, becomes like paramount, even more important than asking someone about like trying to eat more vegetables or trying to get more sleep, which of course would make all of us healthier if we did those things. If we ate more vegetables and got more sleep, we would all be better. But we know that already. The issue is what's getting in our way, what's stopping us. And that's where I feel like having these trauma-informed and health equity lens is really helpful to getting at the heart for patients and for community members as to what's getting in their way. And I think of sleep in particular as being such a direct line into our stress response, into that polyvagal world, because you really need to feel safe in order to get deep sleep. If somewhere in your body, right? If somewhere in your body you don't feel safe, your body isn't going to let go and relax into that deep rest. So telling somebody, get more sleep when they're actually not in an environment where they feel safe is kind of victim blaming, in my opinion. It's really, it's not helpful. And it kind of re-traumatizes people on some level to make them feel like it's their fault that they can't do something that their environment isn't letting them do, which, of course, in the hospital system where I work, we are a safety net system. So we see folks from all walks of life with all experiences. And I can't tell you, particularly in Minneapolis, after the uprising, after the murder of George Floyd, there was a lot more violence on the streets and a lot less engagement from our police. The police in Minneapolis weren't out as much, and they were short-staffed, and there's all sorts of complexities around it, which meant that those of us who lived in Minneapolis heard a lot of gunshots all night long. And I had so many patients who really struggled with sleep because they literally didn't feel safe in their beds and in their bedrooms. And that, you can talk about sleep hygiene all you want to people who are experiencing that. Yeah. It's not really going to make a difference. It's going to be kind of wasted effort.
You're definitely going to sound kind of tone deaf if that's what you're talking about.
Totally. And I've seen it in other examples too of folks who, I'd ask them like, oh, you seem like you're not getting enough sleep. Tell me a little bit about your environment. And they'll be like, I keep all the lights on. And there's a part of my mind that immediately is judging, is like, well, don't do that. Like, that's bad. And then I'll say, why? Why do you keep the lights on? And in one case, this woman told this heartbreaking story that she was a survivor of childhood sexual abuse. And her abuser always came at night when she was asleep. Right. And so she said, I will never sleep with the lights off ever again. And, and I was like, fair enough. Actually, the lights help you feel safe. Yeah, they might also be interfering with your melatonin levels and whatnot. But the lights for her were a mechanism for safety. And so it's this idea of kind of looking at this from the context of people's lives. And then you can also flip it and be like, okay, well, if they're is environmental and social reasons why certain folks are not getting enough sleep, that becomes a health equity driver of poor health outcomes for those people. So we have to look at this sort of bi-directional of like where sleep is like harder to get because of people's context, and then how making sleep more less accessible drives health outcomes. So it's complicated. I don't pretend like I have the answer to it, but I can at least start to like see and name the problem for people, and then it sort of for me puts a different light on the patient care, of different relationship with someone, of creating this more therapeutic relationship in a state of understanding and empathy and problem solving that we can do together. And then it also sort of lights a fire under me of thinking like, well, how can I advocate for more safety in my community? How can I advocate for ways of helping people in general, not just one patient in specific, but get deeper rest in their environment?
Such an important point. And I think maybe perhaps easier to understand than what we were talking about previously with just stress. And stress can have a very similar manifestation in terms of sleep, where you don't have this feeling of safety. You're thinking about that to-do list or your inbox, and it's very similar. You can't rest and digest if you are in flight.
Yeah, right? Yeah, if your body isn't actually, it doesn't matter physically what you're doing. You could be like even meditating and still in a state of extreme stress. And actually, this is, I think it's a funny story. I don't know if other people will find it funny, but when I was in physical therapy school, this was before I was able to really meditate myself, because I thought of myself as having too racing of a mind in order to meditate.
Me too. I'll admit to that too.
I'm like just really lots of racing thoughts. And at that point, trying to meditate actually made me more stressed out, because I would think I was so bad at it, because all I would be like, gosh, I can't stop thinking. I can't stop thinking about thinking. I can't stop thinking about the fact that I'm thinking. And so in PT school, we were doing echocardiograms to kind of show people's heart rates in different states. And so they said, who would like to run up and down the halls for a half an hour and wear a heart rate monitor? And being PT, like half the class or more, like everyone wanted to do that. They said, who would like to rest in a quiet room? And it was like me and two other people that were like, that's what I'd prefer to do. I came to the PT world not from a sports background like most people did. So I thought, taking a nap sounded great to me. But of course, I was in grad school and I had just doused my body with way too much coffee that morning to wake up to get to class on time. So I was just jacked up on too much coffee. So I go into this dark room and I try and rest. And all I can think about is all of the stressors of grad school and things I was worried about. And so I didn't sleep. I just lay there and thought. And then we looked at the echocardiograms and my teacher said, wow, Catherine, you were really running hard. And I was like,
no.
I know, right? I was like, I wasn't running. I was in the sleep room. And he was like, are you okay? So even though I was physically, my body was in a state of rest, inside I was not resting.
I think it's a perfect segue to our next question, because this idea of our body kind of being a vessel that holds all this energy, right? And if we are talking about survival energy and how it's bound to our body during the trauma response of fight or flight or freeze, I want us to maybe touch a little bit on the role of embodiment in polyvagal theory and stress response. So talk to us a little bit about that.
Thank you so much for asking this question. Again, like embodiment, I feel like is this really unique topic that my background is in physical therapy and in yoga. And even before that career of PT and yoga, most of my work was in the performing arts. So in some ways, my whole career path has been like circling around this idea of embodiment, or being present in your body and being connected to your body. And generally, embodiment is thought of as like being present, connected to your body in a positive way, where you feel good about that connection. And an aspect of embodiment, particularly important to polyvagal theory, is this idea of interoception, or our body's ability to both sense and regulate what's happening within our nervous system. So being able to know gosh, I'm in a state of fight flight right now. Ooh, I feel like I'm in a state of freeze. Like being able to recognize the signs in your body that tell you that information and then knowing what to do about it. And the body and these embodiment practices are so invaluable for helping us, especially get out of freeze, but getting out of stress and fight or flight as well. Because the vagus nerve, just physiologically, about 80% of the fibers of the vagus nerve run in the direction of from our body to our brain. So it's the afferent fibers that go from our body, bring information from the body and send it to the brain. And only about 20% of the fibers of the vagus nerve go from our brain to our body. So if we think that we can think ourselves out of a freeze response, if our body is saying, I don't feel this, I'm not feeling it, nothing's going to change because that's 80% saying no, with only 20% saying please, yes, maybe. So we need to kind of really physically get in our bodies in order to stir up that polyvagal nervous system. So practices, and when I talked before about it being a hill, like you have to go from freeze through fight flight to get to rest and digest. And I maybe am too strong when I say that you have to, because this is all, it's a theory. There's a lot of personalization that goes to this, but I do find that it is frequent that if you want to feel more connected to your body, if you want to kind of process stress, that sometimes vigorous movement is very, very helpful. So anything that's aerobic that gets your heart rate up, whether it's running, biking, swimming, even a brisk walk, or even things that are like dancing or martial arts, or just gently like shaking your body, getting that vigorous movement in, it's like giving yourself a dose of fight or flight that's healthy. So again, if we think of that polyvagal hill image, like to get up the hill, things that push us up the hill are things that take away safety, that take away our agency when we don't feel empowered, that pushes us up the hill. So to get back down, we need to establish kind of empowerment and agency and safety, and that will help us get back down the hill. So vigorous movement that we're choosing to do, and maybe even choosing to do because we enjoy it, like that's empowering. That is going to help us get from that freeze response down into the green, into that relaxation zone. And then if we're kind of trapped in this like stress response, this fight or flight response, and we're like, I could run and run and run, and I still don't quite feel relaxed. Another way of doing it is through more gentle means of things like humming, rocking, shaking. I don't know if this is true, but I heard somewhere that every culture slow dances. And I think it is probably true. It seems true to me because it seems a pretty human thing to do, to just gently rock our bodies. And again, when we think of co-regulation, this idea that our nervous systems don't happen in isolation, they happen in a social context. So the more other people are calm around us, the calmer we feel. So this idea of kind of rocking and swaying together, to me, that's like a direct form of co-regulation. And some of the work that I'm so honored to do at Hennepin is I work in our mother-baby day hospital with moms who are experiencing a mental health crisis, and I do trauma-sensitive yoga with them. And sometimes we talk about this fact that when we're in the womb, we're naturally getting rocked and swayed with just the way that the pregnant person walks. It kind of sways the fetus in a little water bath. And so this rocking is really so intrinsic to our nervous system that it comes even before we're born, that it creates this safe space. So when we just gently rock and sway our bodies, it's like literally kind of this pre-birth calming response that we are accessing.
This is wonderful. Thank you so much, Kat. I think it makes us realize that connecting with our body in a whole different level may help to heal a lot of emotional wounds, which is paramount in what we are talking about in healing trauma or any other stress-related types of conditions. And I'll pass it to Dr. FAIHM.
Thank you. Well, I have to say that both Victoria and myself are longtime yoginis.
Yay!
And
Indeed.
Definitely see the value in that, both personally and professionally. So we are very much on board with this and are looking forward to learning more from you. Going a little bit back to have that health equity lens is applied in your work. How have you done this? How is it making a difference? What would a healthcare professional want to know if they were thinking about doing this in their work?
Well, I think it's, again, foundational to have that lens in the work that you're doing, even if you think, well, I'm not working at a safety net hospital, so I don't need to worry about this. I think I would question that assumption. No matter what population you're working with, you are probably encountering folks that on some level or another could use a health equity lens. We think of oftentimes of health equity in terms of race, and that is a huge part of it. But we can also think of it in terms of sexual orientation, in terms of ability or disability. We can think of it in terms of gender. There's a lot of, we can think of it in terms of education or in terms of income and all sorts of things that we are, we can also look at it. We're failing people left and right in America in our health system in various ways. So I think everyone in healthcare could benefit from just examining the work that they do from a health equity lens, of how does your work create more equitable healthcare access and outcomes for folks in our community. But for me, it's actually the biggest prevention for burnout for me is reminding myself that I'm in it for health equity and trying to match the work that I do with those values. And part of how I've done that is by telling myself that I am never going to be an expert, that I'm never going to know it all, and that I need to always be open to being challenged for my assumptions, always be open to learning more, and try as hard as I can to kind of find those opportunities to learn more about what shapes health outcomes for different groups of people. And one example that I'll give of how I incorporated some of that kind of what we think of as like that cultural humility into my practice. I don't know if it's okay to plug another podcast on here, but the the institution that I work with, we have a podcast called the Healthy Matters Podcast, and there was our chief health equity officer, Dr. Neka Setterstrom, was interviewed on that podcast a while back. And the doctor who was interviewing her, he's a white male. And he asked her, he said, like, I'm a white guy, I'm a white male, and I'm seeing patients from all sorts of walks of life who look different than me, who have different experiences than me, different skin tones than me. And how do I, as like a member of this group that has previously marginalized and maybe even caused harm to the same groups of folks that I'm treating, like how do I reconcile that? And what she told him, which I think about this all the time, she just said, you just say exactly what you said to me. You name it. You name the fact that I'm a white-bodied male doctor who's trying to do better. And like just saying that makes a huge difference. And so when I heard her say that, what I did is I I have kind of a welcome packet that I would give to all of my patients the first time they came to see me that had all sorts of information on it. And, a lot of it about what we've talked about sleep and nutrition and lifestyle and things. And I thought, I'm not honoring a person's background if I just give them this lifestyle information without context. So I created a sheet in there that was just a basics on social determinants of health, on like, hey, here's a whole list of things that have nothing to do with anything you've ever done in your life. They just have to do with the way society treats you based on certain things that are not controllable to you. And they drive health outcomes. And so I have this sheet in the packet. And when I'm going through it with patients, when I came to that sheet, I would pause and I would say, like, I would explain what it was and say, hey, I'm a white-bodied provider. And I know that my skin color, people with my skin color have caused harm to people with your skin color. The medical establishment has caused harm in the past. And I don't pretend like I have the answer of how to undo that harm, but I just want you to know that I'm committed to learning from you about how I can help do that. I'm committed to continuing to learn and explore in my own professional practice. And I just want to do better. And just that alone, like I'm not solving anything, but I'm naming it. And I've just had some really powerful encounters with people after going through that page in our packet. Like it's been really, really meaningful for me, and I hope for them too. It seems like it has been, at least.
Over to you, Dr. Karasheva.
Kat, whole health is definitely something that you incorporate a lot in your practice. And just listening to you, how well-rounded you are, how open-minded you are, it makes me think about maybe some of the examples that you can give to other healthcare professionals about implementing that whole person care in their practice.
Well, I think that whole person care, it's such a great term, and it's such an appealing term for everyone to be like, yes, whole person care. That's what I want to do. That's what I'd like to do. I'd like to treat the whole person. And on one level, it's almost like, well, we actually can't. Like one person can't actually treat the whole person. So I feel like I don't try and necessarily do everything for everyone, but what I try and do with patients is understand as much as I can about their whole person experience, which means, again, the symptoms that they're coming to me with, but also the context and the stories behind those symptoms. And then trying to figure out where I can best intervene to help them relieve their suffering. And then how can I connect them with others who can do a better job at different parts? I think of that woman with the lights on when she couldn't sleep. Like I, as a physical therapist, I wasn't going to be her whole person care. I wasn't going to solve every problem for her. But I did make sure that she had a good therapist, that she had someone that could help her with that trauma, in order to have a broader team. And so you really need a team approach. If you are going to practice whole person care, you have to have a team. And I also like to think of it like, I think, in the literature, sometimes people like abbreviate WPC for whole person care, or WPH, whole person health. And I sometimes like to imagine that P moves from, at some level, person to planet. That if we like think of whole person care as like what I'm trying to do for you as an individual, and then we broaden it to think like, well, you as an individual are affected by all of these societal structural things. If we start to focus there, then that lens just gets broader and broader. And suddenly we're not just helping the one person, we're helping to reshape society, and we're helping to kind of create this system change that maybe could lead to that whole planet care, the other WPH, whole planet health.
That puts it well together within the context of, personal circumstances and environmental factors, which is extremely important in every practitioner's work. So thank you for that, kind of bringing together different pieces and integrating them in what we hope would be a standard of care for all of us at some point, right? So I'm going to pass it to Dr. Frame for our final question.
Yeah, so we are running short on time, but I want to make sure we have time for this. You are the founder of the Art of Wellness as a company. Tell us a little bit about it and what you're doing.
Yeah. Oh, thank you for asking. So it's my LLC is sort of the umbrella organization for all of the other stuff that I do outside of my role at Hennepin Healthcare, or some of the other stuff that I do at least. So it's a private practice where I see patients and clients one-on-one. It's also a tool that I use for all of the publishing work that I'm doing. I'm in the process of writing my first book right now, and I do all of my work with the International Journal on Yoga Therapy is through my LLC as well. And then I also do some just speaking and consulting with organizations and with different community organizations as well, helping them kind of look at their work within this trauma-informed lens or within a health equity lens, or providing specific kind of wellness interventions to different organizations. And I do that all through that LLC.
So that's all the time we have for today, but we are definitely going to have you back once that book is out.
I would love that. That would be great. Because the book is all polyvagal nerd centric.
Perfect. Well, let's plan on it. But for now, thank you for joining us. It was so great to have you, Kat.
Oh, thank you. This was just so much fun.
Thank you, Kat. And this is the GW Integrative Medicine podcast from the GW Office of Integrative Medicine and Health.
I'm Dr. Lee Frame.
And I'm Dr. Victoria Karacheva.
Thanks for listening. The Office of Integrative Medicine and Health produces the GW Integrative Medicine podcast with funds from your donations. Your generosity allows us to raise awareness of the benefits of integrating whole person care, including evidence-based complementary therapies, into healthcare broadly. Help us continue to grow the podcast by making a tax-deductible donation on our website, smhs.gwu.edu/OIMH. Click the Give Now button on the left. While you're there, sign up for our free monthly newsletter for even more evidence-based content, including free webinars.